Welcome back. Well, you can see our guests here today, familiar guests. We have Dr. Christine Chung. Nice to see you again, Dr. Chuck Lee from
morning.
Seventh Day Dental. Good morning.
Good morning.
Nice to have you here. Taking care of your teeth throughout your life is an important thing. I mean, we battle that even with my my daughter. Get them to brush their teeth. But as we get older, problems can certainly arise just due to age, and no matter how well you may take care of your teeth. But there are certain signs that there may be a problem beyond just maybe something that's normal. And that's what we want to talk about today. We've often heard about people who have bleeding gums and things like that. So the question is, if someone has that, I think on occasion everybody may get that, even the way you may jam in the toothbrush wrong or something. But when is it to the point where you need to have something like that checked out? If it's something like on a daily basis or?
Well, most of the time to prevent, especially there's an emergency when we see patients with bleeding gum, you need to go to the dentist and check it out. And bleeding gum can cause by, bleeding is inflammation. Mm-hmm. Inflammation is infection, and that caused by bacteria buildup, which known as plaque or tartar. Mm-hmm. And so when things like that happen, the dentists need to evaluate why, and we go in and we clean out the source of infection by removing bacteria or plaque or tartar.
Okay. And Chuck, we've heard about this before as far as, as Christine said, bacteria. And the problem that it can cause bleeding gums, and it can actually cause far more than that. It can cause health problems way beyond your mouth, right?
Research shows that there's a direct connection now between bleeding gums and heart.
Yeah.
Because bacteria in the bloodstream is circulating throughout the whole body. So it has been shown that there's a big connection. So when you have infected gums, you can have infected other parts of the body. And I want to elaborate more about the bleeding gum. Now, if you bleed maybe from flossing one spot, I'm not worried. Right. But I have patients that when they brush, and they floss, all their gums bleed, especially in the back area. And it's because maybe they haven't been into the dentist. A lot of patients have a dentist, but they haven't been in for maybe a year or 2 years, and we're gonna get buildup. It's like a car. If you drive it for a year or two and you don't wash it, you're gonna get more, it's gonna get dirty. So bleeding gum from brushing routinely, or once a week or twice a week, and where you're rinsing out and you're getting some bleeding, that's a concern. And the most important thing is, if we address it early, it can prevent a lot of problems, because bleeding is inflammation. Inflammation can lead to bone destruction, and bone destruction,
tooth loss.
Yeah.
So
and
early diagnosis is good.
Another thing that kind of goes along with this, I would think, are sensitive teeth. Again, it's not unusual that people get that on occasion, but you're talking about, I think, more when you might have one or two particular, a certain tooth that is really consistently giving you problems, right? And it doesn't go away.
Yes, sensitive teeth, it's a very common complaint among all the patients, especially emergency patients. Now, sensitive teeth caused by, tiny movements of fluids in the tubules that in the inner layer of your tooth. So when the outer layer, known as enamel, got eroded or worn down by grinding maybe, the inner layer get exposed where it contains the nerve tissue. So the nerve got irritated and therefore cause sensitive tooth. How do we prevent it? We have to evaluate the situation. We can prevent it by applying a coating of desensitizer or applying a filling over that. Or even sometime when you have gum that receding or get worn down, we can graft or place another tissue over that to protect that layer of exposed dentin or the inner layer of your teeth.
Right,
Do
and
you have-
I was going to ask on that, and you kind of brought that up, is that with the enamel gets worn down, can that be replaced or something on top of, kind of a coating, for lack of a better word?
Yeah. Usually, the enamel doesn't get eroded. Teeth are made up of outer layers of enamel, and the inner layer is dentin. It's very soft. But also, what's more important is the part under the enamel at the root surface. It's a cementum, and that portion, even if you don't brush hard and you have that portion exposed, it's going to erode away just from gentle brushing.
Yeah.
So we definitely can either put a little filling, we can put some kind of desensitizer so that we can get that nerve to calm down, or we can place a tissue over it to cover the root surface so that there's, we don't have that trauma. The most important portion that we want to talk about is sensitive tooth is kind of like a little kitten. If you the nerve is like a kitten. If you gently pat the kitten a few times, fine. But if you do that a million times, you may actually can kill the kitten.
Right,
you know,
right.
from-
How well do we've seen these advertised over the years, mouthwashes, and not the standard mouthwash, but there's ones that are, they recommend swirling around before, after you brush your teeth, and there's all kinds of different brands on that. Do they work, or do they at least help, or?
Everything works.
Okay.
The only thing is, in the dental office, when we prescribe or we give a prescription for a product, it's a lot stronger.
Right.
And the reason it's stronger is because we monitor it.
Right.
So a lot of times I will recommend the patient, you can try that. If it doesn't work, come back and we can give you something a little bit stronger concentration.
Okay. All right.
Yeah, and they do contain fluoride concentration, so that really helps for the sensitivity teeth.
Oh, okay. Now, another problem are chipped teeth. And again, this can be caused one way, you bite down on something and wrong, you chip a tooth that way. But I think you're talking more about when you, maybe an old filling, the tooth gets cracked, something like that, right?
Yeah, so there are many causes why a tooth is chipped. Sometimes it's just accidentally you bite on something, it chipped, or you have a decay underneath the tooth that you might not see or know of, and the enamel just chip away from the erosion or decaying tooth underneath, so that cause a chipped tooth and eventually sensitivity, pain. So we urge the patient, any kind of early symptoms, sensitive tooth, pain, make an appointment, call us, we're always there for you. We'll make a definite diagnosis and do early treatment to prevent major work like a root canal or even a crown, if we can do just a filling over that chip area.
Okay. And I've also, heard people that that it may actually be, just like many other health issues in somebody's life, that problems with teeth may also be hereditary. If you have maybe your parents that always seem to have more problems with their teeth than others, it can be hereditary,
Sure.
right?
Yes.
Sure, I totally believe in that. But I think the most important message that we want to address is that if you feel anything, early treatment is just the way to go.
Yeah.
I've had patients come in where we just adjust a tooth, or we said, oh, this is fine, but it just looked like you bit wrong. And they leave, first of all, they didn't have to pay much to go in, and they leave saying, wow, we didn't have to do anything. It's just a peace of mind.
Yeah,
But
that's true.
But I've also had a little chip, and we can replace it so easily, and sometimes we don't have to numb the patient. And we do it so gently, and afterwards they're happy because now the pain's gone.
Yeah, yeah.
Rather than, oh, that tooth has been chipped for years, but I didn't feel anything. And they're symptom-free, and they keep going, and then now, boom, all of a sudden the nerve is really screaming, saying,
Yeah.
it hurts. And that's when
Exactly.
they come in. And it's just too bad because it could have been a very simple, cheap treatment,
Adjustment.
and then becomes a very expensive treatment.
Yeah,
And that's what
Exactly.
we want to do, is save patients money.
Yeah, and that's the whole point. 7-Day Dental, and we've talked about this before, and I kind of alluded to it earlier. You're there when people need you, right?
Yeah.
You have different locations, and somebody's either on call or one of the locations are open or something like that, right?
Our offices, we have 4 offices, and one of our offices will be open 365 days of the year. We would love to be open here 365 days, but the demand is just not enough. So
Right.
one of our offices in Orange County is open 365 days. So the patients, nowadays, people go to the dentist, some go to the dentist only because of emergency, but they want to be treated then. They don't want
Right.
to wait till 3 days later over the weekend. So that's why we're open all the time.
And for the Laguna Woods, I'm always on call. I do have patients call after hours
Okay.
on the weekend, and I do come out to serve the patients. So,
Oh, very good.
Yes.
And you have a discount for this area as well, right? 20%?
Yeah. So we've decided to have 20% straight across for any procedures for patients that don't have insurance. And
Oh, that's great.
and I think that helps the patient
New
a lot.
patients.
New patients,
Yeah,
or
I mean, we
you know.
welcome all new patients.
That's
And
great.
the great
Yeah.
thing is the bus is right there. There's
Yeah.
a bus stop that stop right in front of our office.
Now, where are you located, since you brought that up?
Moulton and El Toro, right next to Vaughn's.
Okay, so
Right next to Vaughn's.
you know how close that is, so that's very easy to get to. And you're right, the bus comes right there. So if you're having some problems, look them up at 7daydental.com. And you've had this company for quite a while now, right?
We've been around for 25 years.
Yeah.
And this location in Laguna Woods has been 15 years.
Wow.
So we've been around for a while.
We
Yeah.
started in 2000.
Yeah, and I think it's a great thing that you've done as far as the concept of 7-Day Dental, and certainly unique. And as you can see, that if you have just what you might think is a problem, even if you don't, and you don't have a dentist that you're going to, now give them a call and stop by, because as they just told you, they may spot something that you don't know about. Maybe you're perfectly fine and there's nothing there, but you have that peace of mind of
Yes.
getting things checked out, right?
Yes.
Very good. Again, 7daydental.com, and right over here by the Vaughn's, in the Vaughn's Shopping Center, so you know where that is. Great advice. We appreciate you coming on.
Thank you.
Thank you so much.
And
for having
we'll probably
us.
see you again soon.
Okay, yeah.
All right.
Absolutely.
You take
We
care.
look forward to seeing the patients.
Yeah, definitely. Go by there, because you can see that, and with the 20% off, and that's a great deal. So take care of your teeth, right? All right. Hey, good to see you both.
Thank you.
All right, we'll be right back.
Yes, it's true. 7-Day Dental has the best doctors and great staff. 7-Day Dental is giving all senior citizens a complete exam for this month only, including x-rays, for only $35. You heard it right, only $35 for exam, including x-rays to all senior citizens. Go to 7daydental.com to find the location nearest you. 7daydental.com, where smiles are born.